Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A large study published in the journal Gut in September 2021 showed that individuals who routinely consume a more plant-based diet are less prone to contract COVID-19 infections, and they're much less prone to develop serious complications if they contract COVID-19. Now, many of us in the nutritional medicine world have suspected for a long time that this would be the case, but this large-scale study involving almost 600,000 people in the UK and the United States has provided compelling evidence for this assertion. Now, although metabolic conditions like obesity and type 2 diabetes have been linked to an increased risk of COVID-19, as well as an increased risk of more serious side effects and complications, the impact of diet on risk of COVID-19 infections and its complications has not been highlighted sort of in the mainstream messaging, at least not until recently. Previous reports had suggested that poor nutrition is a common feature among groups who are disproportionately affected by the pandemic, but data on the association between diet and COVID-19 risk and severity were lacking until this recent study in the journal Gut in September of 2021. So the study examined almost 600,000 participants of the smartphone-based COVID-19 symptom study, as it's called. Followed these individuals, these 600,000 individuals, from March 24th, 2020 until December 2nd, 2020. At the start of the study, the participants completed a questionnaire that asked them about their dietary habits before the pandemic. And the participants were each given a sort of diet score based on sort of the healthful plant-based diet score. So the healthier their diet, the more plant-based it was, the higher was their score. The study showed that those who were in the top 25% of plant-based diet score, who had like better scores, had a 9% lower risk of developing COVID-19, but a 41% lower risk of developing severe COVID-19 symptoms and complications. In other words, the healthier the person's diet, the lower was their risk of infection, and they had a significantly dramatic lower risk of complications if they developed the virus. As Dr. Meschino stated, these findings were consistent across a range of sensitivity and a range of sensitivity analysis accounting for other healthy behaviors and social determinants of health and community virus transmission rates. That means that after they look at all the other variables, having a poor diet stands out as a significant risk factor for COVID-19 infection, and very much so for its complications. The co-researcher, Dr. Andrew Chen, who's a gastroenterologist, went on to state, although we can't emphasize enough the importance of getting vaccinated and wearing a mask in crowded indoor settings, our study suggests that individuals can also potentially reduce the risk of getting COVID-19 or having poor outcomes by paying attention to their diet. Dr. Meschino concluded that the models estimate that nearly 1/3 of COVID-19 cases would have been prevented if either healthy, more plant-based diets were more common across the population, and or improvements were made in socioeconomic circumstances that lead to unhealthy food choices that often produce nutrient deficiencies and or marginal nutrient deficiencies. Dr. Meschino stated, our findings are a call to governments and stakeholders to prioritize healthy diets and well-being with impactful policies. Otherwise, we risk losing decades of economic progress and substantial increase in health disparities. The bottom line is that specific nutrients are required to support the body's immune system. I've provided a number of lifestyle medicine update videos on this subject in the past, featuring the role of specific nutrients of importance, and included the scientific references that support these facts. In my view, it's unfortunate that health authorities have not yet emphasized the importance of evidence-based dietary strategies, lifestyle and nutritional medicine to help support immune function as an adjunct to vaccination, social distancing, and wearing masks during the recent pandemic. The September 2021 study published in the journal Gut adds to the growing number of studies demonstrating the importance of nutrition, lifestyle, and nutritional medicine practices that can support our immune system, many of which are associated with reduced risk of COVID-19 infection and its serious complications. So I've included the reference for the study in the text below. Thanks for watching, and I'll see you next time.